last patient today is Mrs. Mock, and Rachel, you're her liaison? Yes. Okay. How's she doing on the unit from nursing's perspective?
Her vitals are stable. She's continent, though. She last night woke up at about middle of the night three or four times and had loose BM. So that just happened last night. That's a change.
Any change with her mobility?
Yeah, she's actually doing worse this week. She was walking with supervision, and now she's walking with one person min assist with the two-wheeled walker and going about 30 meters. I did manage to do stairs with her today, one person min assist with 2 rails. We did 6 stairs. So that is a change. Last week she was supervision. So I've put down for the goals that we want to get her back to only requiring supervision, not one person assist. So
okay.
A little bit backwards this week.
Yeah, we also noticed a decline in OT for transfers. Last week she was supervision. Now she's one person min assist with her 2-wheel walker. And she was saying that she was very fatigued as well because she was having bowel movements 4 times at least last night. So the goal is to, as well, get her back to supervision status. And she's also been requiring minimum assistance for dressing. So her goals are trying to utilize those long handle aids to get more independent with the dressing aids, and also be able to get to the bathroom in time with her walker.
I just see an issue here around her falls risk, and I guess maybe is that related to her change in function a little bit too?
Yeah, she's definitely at risk for falls. I mean, her balance isn't very good. Her Berg was only, I think, a 26. So we put a chair alarm on yesterday. That is going okay on the ward?
Yes, she's needing it though.
Okay, so we'll just continue to monitor with the chair alarm on and the bed alarm, I guess, at night?
Yeah.
She's getting up so frequently. So I'm going to mark that one as completed. And any IADL work this week? I guess maybe not if she's...
No, I think we have to wait till we figure out whether she's having C. diff, and with her fatigue levels, it's really hard to work on any meal prep. And the goal is still to be able to do simple meal prep at home. But I think the daughter was also helping a little bit of the IDLs. So.
Okay, and Rachel, how's her family holding up? How's she holding up?
Actually, the daughter has been here a lot of times, and I've talked to both the patient and the daughter. It sounds, because the patient was quite independent before, but the daughter is providing assistance. However, I guess there's some caregiver stress, and I'm going to provide some more information in terms of the community resources.
And there's a note or an action issue here around pain on weight bearing.
Yeah, so I'm just noticing during therapy that she definitely has a lot of pain when she's standing up and walking, putting weight through that leg. So I'm wondering if we could have some meds before.
Yeah, for sure. Is she using a lot of breakthrough?
She is. She is
okay.
asking for pain medication.
Okay. So I'll review her medications in order to put her on some long-acting and put her in pre-therapy dose.
What time do you usually do PT?
10:15.
So we'll make sure to give it to her about, 20 minutes or 30 minutes prior to therapy? Okay.
And the language barrier, I know this came up before, that you guys were having trouble communicating with her?
Yeah, so Wendy helped me this week, so we were able to educate her about the importance of participating in therapy, and it was a little bit better, and then she's kind of gone back downhill a little bit with the loose BM, so that is completed.
So you just use joint sessions?
Yeah.
Okay, great. And so we'll just complete this one as well with the falls risk. I know that her loose BMs overnight last night, and we're just waiting for a stool sample.
We haven't collected it.
Okay.
This just happened last night, but we'll do that.
Okay.
Now maybe order some blood work and just review her hemoglobin, just given you guys are reporting she's fatigued as well. So.
Okay. Great. And I think the only other thing is I know her family had asked about a weekend pass or to go for a day pass this weekend, but it sounds like functionally she might not be ready for that yet. What do you guys think?
Yeah, the daughter did come in, and we had practiced the car transfer and gave some education on using equipment. But I think considering that she's so fatigued and then the C. diff is not sure yet.
I'm also concerned about her going home for a day pass, even though there's no stairs to get into the house. I've heard about all the clutter, and she is walking with a two-wheeled walker, and I'm wondering if there's even space for the two-wheeled walker. So I think we should hold off on the day pass until we have the home OT visit and the C. diff
Yeah, I
under
agree.
control, or the loose BMs or whatever that is under control.
Yeah, I talked to the daughter a little briefly about the space, and she says she's available to help with clearing out some stuff. So yeah, I processed the home care OT referral through TSD, and that was originally planned possibly for next week on the 26th, but considering all the factors, that we probably should push the date back.
Okay. And Rachel, are you okay to talk to the family about the day pass? So maybe. I would tell the daughter about it. Okay, and we'll just let them know once she is ready for a pass, I guess. Okay, great. Any other remaining issues for this patient?
Just the EDD there.
Oh yeah. Okay. So let's. Given everything that's going on for her, and just I'm thinking that the family was probably planning ahead for the fact that we were thinking she'd be ready to go home in about 2 weeks or 13 days. Does that seem realistic to you guys right now?
Well, we definitely need a weekend pass before she goes home.
a day pass and then an overnight pass.
And we still want to wait for the pre-discharge, which we don't think she's going to be ready for next week.
Yeah.
So do you want to push that date back a little bit more maybe?
Yeah, I think so. Maybe push it a week and then we can review next week.
Okay, sounds great. And I'll just print this for us. And then maybe we can do a quick debrief. So how was that for everybody? How were rounds today? Did we go through the patient goals?
I think so. I think we did it. We touched on the goals, and they all seem to be worded in patient-centered language.
Can we look at the medical goals?
Yeah.
So send a stool sample for culture. Maybe we can. I can put that in more of an
action issue.
More of an action
Yeah.
issue.
Yeah.
That's but in terms of the patient, I mean, she's saying she would like to be able to sleep through the night and not have to go to the bathroom. Maybe that can be put as a short-term medical goal. I don't know. It's more in her language.
Yeah. So maybe.
I'd like to not get up in the middle of the night to go to the bathroom. I mean, that's what she was saying.
I'm trying to think,
Yeah, we could. That's probably
just a less
waking up.
less need to go to the bathroom.
Yeah.
So Rachel, you can talk to the patient when you go over the goal sheet and just review that.
Okay. I'll just put just be able to sleep better at night. Perfect. And okay. And what about we talked about nighttime toileting, just that she is having to get up quite a bit. And I don't think we're quite ready to talk about self-meds for her.
Right, and we reviewed the EDD, and there's a patient liaison, so I think we did well.
Yeah, no side conversations, and I think everyone's pretty clear on the plan. Okay, so thanks everyone, that sounds great. I think we're all really clear on the plan.
Yeah.
Great.